One is about improving access to care. That's what this is about. Making it possible for every patient, every member of our community to have access to physical medicine, to patient care, to our emergency rooms, to our hospital, to our doctors, our physicians.
Those supporting Hidalgo County's Proposition 1 to pass say a health district would make care, at least health care, more accessible to the uninsured.
The county already has a program to pay for those people to get medical care. Channel 5's Leslie Aguilar joins us from our Hidalgo County newsroom to explain how that program works now, who falls through the cracks, that is, and how the healthcare district could change things. Leslie.
Right now, Hidalgo County budgets $5.5 million of taxpayer money to pay for indigent care. The county covers the minimum amount of people as required by the state. Those in favor of the healthcare district say more people could get coverage if Prop 1 passes.
The main responsibility of the healthcare district would be operating hospital facilities and providing medical and hospital care for the district's indigent residents. Hidalgo County already has a program to take care of those who are indigent. It's required by the state. Not many families qualify for that care, though. Health Director Eddie Oliveras says the county gets about 9,000 applications for the county coverage each year.
But only about 5,200 actually qualify for indigent health care.
To qualify, you must be a Hidalgo County resident. You must live at 21% or less of the federal poverty level. An income of $24,300 is the federal poverty guideline for a family of 4. 21% poverty is about $5,000. That means only the poorest of the poor qualify for county health care. Those who do qualify are able to use up to $30,000 a year for primary care and hospital visits. The county budgets $5.5 million to pay for those who qualify. The federal government matches every dollar with $1.36. That turns the $5.5 million into about $13 million. Last year, the county spent about $9 million on indigent care. The remaining $4 million goes to a nonprofit organization called Hidalgo County Clinical Services Incorporated.
It is an organization that's run by the private hospitals in our county. And that organization is the one that determines the use of the uncompensated care.
Uncompensated care means hospital care that was not paid for. It comes mostly from emergency room visits of people without insurance.
There's a gap of working poor who do not have access to health care due to the fact that they make too much money to qualify for indigent care, but not making enough money to pay for or have access to private insurance.
About 1 in 4 people in Hidalgo County fall through that gap. Ann Cass is the executive director of Proyecto Azteca and a board member of the RGV Equal Voice Network. She believes a healthcare district would help make the healthcare gap smaller.
Would it be guaranteed that everybody in Hidalgo County could get healthcare?
It won't guarantee that because we do not have a hospital, a public hospital. Okay, but it certainly would, the money that would go to the clinics would allow them to use that money for thousands of more people to get the secondary care.
Hospitals who are financially supporting Proposition 1 all signed an unofficial agreement to send 20% of tax revenue raised to free healthcare clinics in the Valley. Those clinics treat many of the people who fall through that healthcare gap.
Why should the people of Hidalgo County be responsible for the health care of everybody else?
Mission Mayor Beto Salinas is against Proposition 1. He says the tax that would start out at 8 cents per $100 of property valuation is just too much.
Indigent health care is the responsibility of the hospitals. They came to this area and they knew that we had Mexico to the south and we had a lot of poor people.
Cass argues that Hidalgo County residents already indirectly pay for the uninsured through inflated hospital rates and insurance premiums.
If you don't have insurance and you have to be hospitalized, who's going to pay for that services? It's going to be those of us who do have insurance.
She says the healthcare district would make preventative care more accessible, which is much less expensive than emergency room care. Salinas says Hidalgo County residents just can't afford it.
We just don't need any more taxes. People that are paying taxes have too many other entities that they have to pay taxes for.
It's up to the voters to decide.
The healthcare district would be run by a board of directors. Their meetings would be subject to the Open Meetings Act. The county commission would have to approve their budget. Hidalgo County Clinical Services Incorporated, the nonprofit group that distributes funds for uncompensated care right now, is not subject to open meetings. In our Hidalgo County newsroom, Leslie Aguilar, Channel 5 News at 6.